And I would explain to them, look, there's a business that I'm an investor in and I'm on the board of. They're treating your kids, even though that your MCOs are not paying for these kids' care. We're saving lives and keeping you out of the headlines. What can you do to help us make sure that we get paid? And boom, I mean, state Medicaid director after state Medicaid director applied a little pressure to remind the health plan leaders, like, hey, do you want to still be getting paid by the state? Turn on the faucet, we got paid, and all of a sudden, this is like an incredibly profitable business. The profit is driven based on improved clinical outcomes, and those short-term investments ended up having pretty remarkable long-term financial and societal impact. There will be more money made in the long term by doing the right thing for patients.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage.
Our esteemed guest today is Dr. Andrey Ostrovsky. Dr. Ostrovsky is many things. He is an entrepreneur, practicing physician. He's a former health transformer. Although I guess
still a health transformer, Logan. Is that a lifelong designation?
You stole my next line, Andrey. I was going to say this is more of a Hotel California situation. Once you check in, you can't check out. So you're definitely still a health transformer. Notably, he was also the chief medical officer of Medicaid, 2016 to 2017. And he's currently the founder and managing director of Social Innovation Ventures, where he pulls together his experience as a policy expert and a founder to invest in high impact companies addressing big social needs. So Andrey, thank you for taking the time to join us here on our first Fireside Chat of 2021. Awesome, Andrey. Well, let's start a bit with your journey. I mentioned that you are a health transformer, founder of a company called Care at Hand. And so could we go back and tell us what your company was all about, what you were building when you were a founder in the startup health family and in the portfolio, kind of what that was all about?
Sure. Care at Hand was going after the problem of helping people age and thrive in the community safely. My co-founder and I, Jeff Levy, we had the insight that there was some really productive mobile technology developments around 2010 that could be applicable to the home setting, and increasingly there was a financial incentive and push to keep the elderly out of the hospital, preventing readmissions. And so we created a platform that identified which elderly individuals could be at increased risk for hospitalization, and in particular rehospitalization. And the unique aspect of our approach was that we had the insight that the most influential care team members were not folks like me as the clinician, but usually the non-clinical care team members. And so we thought if there was a way that we could somehow digitize the hunch of a non-clinical care team member, like an adult child or a home care worker, perhaps that could be a way that we could use the existing people around the patient to identify risk factors for readmission, and then have a leading indicator that care teams could use to intervene and prevent someone from bouncing back to the hospital. We ended up developing some pretty elegant technology, publishing some studies around the validity of those algorithms and that technology. And then we ended up selling the company to a company called Mindula Health in 2016, which to this day is using the technology we built as the backbone of their platform. So that sounds like a great, fun journey and success and all that, but I'm happy to tell the more important parts, which are huge missteps.
Yeah, exactly. Totally. Let's dig in there. Well, what do you wish that you knew then that you know now? What do you wish that 2013 founder knew?
I think one of the key tenets around investing and or operating in the digital health space that I I think I ended up discovering around, I think it was 2013 or 2014. So 2010, 2011 is when we founded the company. And we were going after a pure software play. And it became quite apparent then in 2014, and I would say it's even more so now, that creating value outside of the healthcare space is totally possible with the pure software play, especially places like fintech or prop tech, or insert any other space in tech. Healthcare, however, I found that if a solution or an experience does not own the substantive chunk of the healthcare stack, that it will never break through or overcome the activation energy needed to create enough value in the healthcare system, which is a mostly fee-for-service system. And so what I've kind of relegated in my mind, pure software plays in the digital health space, is really only in kind of business processes, or maybe business process as a service. So revenue cycle management, I have a couple of investments in that space. I think those companies will do really well, and they're pure software plays. It's incredibly hard to build a viable venture level growth business that's pure software. And so in 2014, what I should have done is actually closed down the business and then rebooted it as a full stack offering of tech-enabled services. And I'm very bullish on tech-enabled services, and that's the majority of my portfolio of investments out of, I think, 18 investments now. Basically tackling boring brick and mortar businesses and just out-competing them because the technology happens to eliminate certain inefficiencies and or create a more convenient patient or consumer experience. That's probably the biggest thing I should have done to create investor value and more importantly, patient value. But I was a stubborn first-time entrepreneur who was also in clinical training, and I thought I knew what was best. And yeah.
What were some of the lessons you learned going through the acquisition process?
Don't start a company. No, I'm kidding. I'm so grateful I did it. I would do it again. I found that having a few dozen angel investors was a very painful experience to get signatures. I found that having clear communications with investors was probably one of the best pieces of advice I took. We went through 3 acquisition offers between January of 2016 and when we sold the company in May of 2016. And 2 out of the 3 acquisition offers had very significant, let's say, interactions with investors that weighed on the outcome of the acquisition or the negotiations. And I've advocated for many of my portfolio companies now to be really careful about whose money they're taking and trying to minimize taking, the usual, like you set a limit on what size check you're willing to take. And if it's a small check, it damn well better be a very strategic investor. And also one that's really mission aligned. Nothing against private equity folks. I'm on a couple of boards owned by private equity companies that I deeply respect. But I have to say, like, the biggest challenge I had in navigating the M&A activity was from a couple of angels who were private equity folks that had a private equity mindset and clearly never operated a startup. And so expectations were fundamentally different. They were talking about, well, what about my warrants and exercising certain options? I'm like, this isn't PillPack, my friend. Like this is a much more modest. This is a much more modest transaction, and you're compromising some kind of interesting investor returns just to kind of be, frankly, greedy. And I will say, like, I just sold a company on December 31st, which I'm super excited about, and with a little internet sleuthing, you could probably figure out which company it is. I took those lessons, and I was on the board of that company. I took those lessons to heart and very significantly protected the founder and reminded them that, that whether you get an X percent of the transaction or X plus 1% kind of doesn't matter, because this isn't $1 billion transaction. And so I think having an entrepreneur mindset and a founder-friendly mindset is really what I learned from my M&A activity. And I think that's been good, because I have a generally a favorable reputation with my companies, that I usually go to bat for my founders regardless of my financial returns.
Let's fast forward a little bit in your journey. You were asked to be the chief medical officer at the Office of Medicaid. And I just want to stop there and just say, what was it like to get that offer, that phone call? If you could take us back to kind of that transition period, and just what was that like?
It was a testament to the whole notion of, Pastor, whoever was quoted as saying, luck shines favorably on the prepared mind. I was very lucky to have an opportunity to take on a role for which I was grossly unprepared for, and simultaneously way overqualified for. And what I mean by that is, I had sold into Medicaid pretty extensively. As a pediatrician, most of the kids I saw were Medicaid reimbursed. I understood, many of the peripheral aspects of the Medicaid program, but the guts of it, the policy, the statutory, the regulatory underpinnings, I really had no idea. And so in that regard, I had a lot of angst around taking on a role that, I wasn't a lawyer. I didn't understand some of those aspects. But what I was being asked to do was introduce change management to a highly bureaucratic organization. And as a startup founder and someone who it took some level of rigor in building my own skill set around, building product, customer development, strategy, general organizational management principles, and design, agile, lean, those types of skill sets. That's basically the toolbox of change management. And I knew those things pretty well. And that's what I was being asked to do, to come into the National Medicaid program and help evolve the organization to be more customer centric and more streamlined. The way I got that role was one of my mentors, Patrick Conway, who remains a great mentor and friend of mine. He's someone who I had a quarterly mentorship call with ever since I started residency. And he ended up reaching back out to me in a couple of weeks saying, I've got a job for you, and I need you to go help run this program. And to which I responded, how the hell could I do that? Just for the same rationale I just laid out to you all. And he reminded me, and it was very obvious, it was an opportunity of a lifetime. And that, if you can figure out starting a company and growing a company and selling a company like you all are doing right now, you can pretty much figure out anything, right? Our jobs are literally to learn super fast, be kind and gracious, and discover value super efficiently. And the whole, walk through walls metaphorically, in some cases, literally. That was a pretty good preparation. And so I took the role, and it was the first 4 months were awesome. And then they weren't. But I'm grateful for the experience.
Why don't you take a moment to kind of school us a bit on Medicaid and Medicare? You said you came in having sold into Medicaid, but then really there was just a body of information that you didn't know yet. So I'm sure it was drinking from the fire hose of information. We've got folks on the call who some play in that sandbox, some don't, some from the United States, some not from the United States. So Medicaid versus Medicare, give us some top line knowledge.
Medicaid is the national public health insurance program for people who are in poverty and or who have some kind of functional deficit. Contrast that with the Medicare program, which is the national public insurance program for people that are 65 years and older, or people with end-stage renal disease, or people also with functional compromise and that have basically been Medicaid eligible for 2 or more years, and they can kind of bump up to Medicare eligibility that way. The Statutory underpinnings for the Medicaid program are outlined in the Social Security Act Title 19, and there's a lovely chapter that I do not encourage you guys to go out and read. And then similarly for the Medicare program, it's indoctrinated in Title 18 of the Social Security Act. A really important business development aspect that is a difference between the two programs is Medicare is centralized. It is run out of the Baltimore office of the Centers for Medicare and Medicaid Services. And what happens centrally is basically doctrine across all of the United States, with a little nuance in that Medicare administrative contractors, MACs or MACs, have some local coverage determination flexibility. But basically, if there is a certain CPT code that has a certain level of reimbursement and it's decided upon by Medicare centrally, it basically is gospel across all of the United States. Contrast that with the Medicaid program. It's a federated program, which is a federal and state partnership. Each state and territory, so 56 in total, have their own state Medicaid office. They have their own state Medicaid plan. And each state and territory basically have to get the approval of the Fed centrally in order to approve what is the benefit for whom, how much it's paid out. And so it's highly variable. Medicare, consistent, centralized; Medicaid, highly variable and state driven.
So you said that there's pros and cons to going the centralized Medicare route versus the 56 at bats. Do you feel like those are, I mean, you're talking to a bunch of entrepreneurs here. Do you feel like those are pretty even odds, or do you have, recommendations as to how someone should go about this?
Yeah, I have a relatively straightforward recommendation. I would say that focusing your company's business development, customer development, or product development activities should really start with first principles, which is, what does your end user need or want? Like, do you want to create value for someone who more likely is a Medicaid eligible beneficiary, or do you want to primarily create value for someone who's a Medicare Benny? Or I would actually advocate in almost all cases, don't start with public payer and go to where it's the easiest to sell when there's the highest margins, which is in the employer sponsored insurance space. And that's a philosophical tune that I have fundamentally changed from the time when I was operating Care at Hand until now, because I was myopically and ideologically convincing myself that if I'm not trying to serve the duals population, then I'm not doing my job to have social impact, blah, blah, blah. When in reality, like, I wasn't doing my job to have social impact because I wasn't creating a profitable business. And in the end, like, yeah, we had like a fine M&A activity, but it wasn't at the level of scale that anyone would say like has fundamentally changed the American healthcare system. And so I would say build a viable business first, ideally one that is profitable. And if it's not profitable, at least have really meaningful revenue growth. And once you have your beachhead identified and you have that flywheel and you're generating revenue, every customer in the space reflexively thinks of your company's name, then start to evolve your strategic framework for the next 2, 3, 5, 10 years to back into the public payer space. Because then you'll have the margins, you have the credibility with your board and your investors to start taking risks where perhaps margins on a unit economic basis, or not perhaps, they will be lower on a unit economic basis, especially Medicaid, but damn, the TAM is huge.
As a leader, and you're sitting on boards, you're advising companies, how do you help people pragmatically to walk that line between their passion to fight disparities in health, to have that why, and to also be profit driven and to build a business that is going to thrive in a capital market, because you know that the one feeds the other and you can't have the impact without the success. So as a leader, how do you instill that in people? Because it's one thing to say it, it's another thing to do it.
Yeah, I think if I'm through and through capitalist. I think if people don't see the return on equity investment opportunity in serving poor populations than trying to convince them that there's some kind of social mission is a lost cause. I very much prefer to lean with show people the green. What I often do is when there's this is mostly with private equity owned businesses, if there are investors that saw a investment opportunity in serving a Medicaid or duals population, and they have a decision to make a fork in the road. For example, early COVID, there were some very challenging decisions to be made. Explaining the difference between short-term and long-term consequences of certain decisions and forks in the road in financial terms, that has been really helpful. And there's a business called Blue Cloud Pediatric Ambulatory Surgical Centers. They're owned by Norwest Venture Partners. And during early COVID, we had a decision to make. We needed to decide, do we cut our costs and let go of a ton of workforce, which itself is often on the cusp of poverty? Or do we take the short or medium term hit, invest more in the company, keep people on board as long as possible, with the bet being that if we keep them on board, we're going to have profoundly more employee loyalty, profoundly better customer experience, clinical quality, and we'll be the fastest ones to ramp back up once all the stay-at-home orders get pulled back. That was one bet. The other bet was that, do we keep treating the kids for whom we do not have Medicaid coverage yet, for whom we are not in network with their payer yet? And we had, again, choice to make. We could treat these kids and take a pretty significant hit, or we could turn them away. They have, and these are mostly kids with complex care issues. They're oftentimes have cognitive impairment, so a general dentist can't treat them. You need anesthesia in order to do any kind of dental work. And so these are very high, kids are highly prone to complications from something as simple as a dental carie, which could quickly turn into an abscess and quickly just deteriorate into badness. And the company made the conscious decision, which I didn't have to do too much arm twisting. I just kind of laid out that my hypothesis is, if we make these short-term investments and perhaps not make cost reductions and look better from a EBITDA perspective, in the short term, it may hurt, but in the long term, it'll be beneficial. And what ended up happening is the company ended up, for the reasons I just described, exceeding its pre-COVID 2020 budget. It was more profitable than expected, despite COVID happening, because of all these reasons. Like, we were first to turn back on. We didn't have all the massive churn that everyone else had and had to rehire. Our employees loved the company because they were able to keep putting food on the table. So that was amazing. That bet panned out. And then we shared with some of and this is where, if any of you go the government route, post-entrepreneurship, this is where you can have an outsized impact as an investor, board member. I would go to my state Medicaid colleagues and I would explain to them, look, there's a business that I'm an investor in and I'm on the board of. They're treating your kids, even though that your MCOs are not paying for these kids' care. We're saving lives and keeping you out of the headlines. What can you do to help us make sure that we get paid? And boom, state Medicaid director after state Medicaid director applied a little pressure to remind the health plan leaders, like, hey, do you want to still be getting paid by the state? Turn on the faucet, we got paid. And all of a sudden, this is like an incredibly profitable business. The profit is driven based on improved clinical outcomes. And those short-term investments ended up having pretty remarkable long-term financial and societal impact. There will be more money made in the long term by doing the right thing for patients.
Yeah, making the smart financial move as well. That's awesome. Thanks, Andrey. Let's shift gears and get some questions from the audience. I see Beth Sanders from Life Bio. You have a question there.
Do you see a move to more reimbursement for mental health and behavioral health kinds of things coming? Is there going to be a shift into a more social model of care from what you know about the federal government as we go forward?
Great questions, and great to meet you, Beth. In terms of mental health reimbursement going up, I think that is a solid maybe. Probably will continue to have, again, marginal improvements, but not wholesale change in that regard. Most of the US healthcare system is still predominantly, overwhelmingly fee-for-service based. And until we have a shift away from fee-for-service, prevention and upstream health determinants won't be profitable.
Andrey, we're at the top of the hour. There are so many things we could continue to talk about. We didn't even get into more questions about your current role as an investor. There's just so much we could dig into. I hope we can maybe do this again sometime. Doing that, I want to kick it over to our CEO, Stephen Krein, to maybe share his insight.
Hello, everybody. Happy New Year. And Andrey, it is awesome to see you, man. I am beyond, you and I were just chatting back and forth, how beyond thrilled we are that you've done this incredible tour of duty in healthcare, right? You're a doctor, actually, most importantly, you're a husband, a father, an author, and a doctor. But then you became a health transformer and really got to experience everything that it means to be an entrepreneur. You became the chief medical officer of Medicaid. You're now an investor in one of the health transformers, City Block, no less. 3 years from now, where do you see yourself, and what has to happen for you to feel happy about your progress over the next 3 years?
Oh man, Steve, it's good to hear your voice. 3 years from now, I will probably be founding a tech-enabled PACE program or a tech-enabled pediatric specialty, complex care health plan, or some other business, who knows? I suspect that I'll likely be getting my hands dirty again. But until then, I've got some commitments with portfolio company investments that need some hand-holding. So
thank you, Andrey, for taking time out of your busy schedule to share your experience, your knowledge. It was awesome. So we do fireside chats with awesome people like Dr. Ostrovsky every Tuesday. Those are all on startuphealth.com/events. We encourage you to put them on your calendar and come out and join the conversation.